This article is called Lengthening the Hamstring Muscles Without Stretching Using Awareness Through Movement, Stefan et al., 2006.
Passive stretching has always been widely used to increase muscle flexibility before and after exercise, but it has been shown that the process does not produce long-term changes in the elastic properties of muscles as it was previously thought. So in 2006, James Stephan and a group of researchers from Widener University investigated the possible applications of using awareness through movement techniques through Feldenkrais's method to increase the length of hamstring muscle strength without using passive stretching.
But first, what is the Feldenkrais method and awareness through movement? Awareness through movement is the process of verbally guiding a person through a series of active movements that are performed slowly, gently, and thoughtfully. This was discovered by Feldenkrais, who suggested the importance of conscious movements to improve the mind-body connection while also improving body function. So, with ATM, the guided movements are meant for the individual to focus on the quality of the movements, with the mind consciously guiding the body through various active movements. However, what is important to remember with ATM exercises is that the movements should all be within a comfortable range, and not until you reach your limit or end range to feel resistance or some sort of pain, which is usually facilitated by traditional stretching. For example, passive stretching, a form of static stretching, requires an outer force to be exerted upon a muscle or limb to move it to a new position in which some resistance or discomfort is felt.
In this study, the authors developed ATM techniques designed to see if, through these methods, hamstring muscles could be lengthened as a measure of muscle flexibility and strength. Different methods such as static stretching, proprioceptive neuromuscular facilitation, and dynamic range of motion have been used to increase hamstring muscle flexibility, but none have tried using the process of active motion without pushing to the end range to achieve results, which is what this study tested.
This research article is a primary source as it uses original information and data created at the time of the study. As well, it is a mixed method study using the qualitative data in the form of open-ended questions to the participants to help analyze the quantitative data and results. The study design for this article is a random controlled trial, as it is an experimental study where the researchers controlled who participated in the ATM intervention and which participants were the controls. This design was determined by the study question to see if awareness through movement techniques could be used to lengthen hamstrings. The null hypothesis was that ATM could not increase the length of the hamstring muscles, while the alternative hypothesis was that ATM can be used effectively to increase the active length of the hamstring muscles. In the study, the dependent variable was the hamstring muscle length and the maximum active knee extension measured of the hamstring muscle flexibility, while the independent or input variable was the ATM intervention.
To be part of the study, the researchers set multiple inclusion and exclusion criteria. First, 51 subjects were initially recruited from a population of graduate students and faculty at Widener University in Chester, Pennsylvania. Individuals with a history of orthopedic problems, including surgery or injury to the back, pelvis, or lower extremities, were excluded. As well, they were excluded if they had neurological dysfunction within 1 year from beginning of the study. For example, those with multiple sclerosis, cerebral palsy, or peripheral dysfunction. Lastly, they were excluded if they had an active knee extension greater than 165 degrees. This was outside the desired range for the experiment, a delimitation set by the researchers due to the measurement tool only measuring to a maximum of 180 degrees.
Out of the 51 initially screened, 7 participants were excluded because their hamstring muscle length exceeded the maximum standard set by the researchers. As well, 6 others withdrew due to personal reasons before group assignment. This left 38 participants, of which they were randomly sorted into a group of 20 people receiving the ATM intervention or the control group of 18 people who received no treatment. 5 subjects dropped from the study after group assignment, 2 from the ATM group and 3 from the control group. So, 33 subjects with 18 in the ATM group and 15 in the control group met the screening criteria and completed the study, which had a 3-week period of the intervention. The ATM group was made out of 7 males and 11 females ranging from 22 to 36 years old, with a pre-test hamstring muscle length measurement of 141.96 plus or minus 7.89 degrees. The control group was made up of 6 males and 9 females, ranging in the ages of 21 to 27 years old, with a pretest hamstring muscle length measurement of 140.66 degrees plus or minus 8.19 degrees. There were no statistically significant differences between the groups based on age, sex, or pretest hamstring muscle length.
To reduce possible confounding variables, subjects from both groups were asked not to start any new physical activities, specifically hamstring muscle stretching, that had not been part of the regular activity prior to starting the 3-week intervention period.
The active knee extension hamstring muscle length was measured in the range of knee extension through the active knee extension test of the right leg using a peak modus motion analysis system twice for each subject, for the pre-test and the post-test. And this was after the 3-week intervention phase for both the ATM intervention and the control group. A video camera was used to record the movement, which was digitalized using the Peak Modus software. 3 repeated measurements from each subject were used for each of the pre-test and post-test calculations. The pre-test measurement was conducted 1 week before the intervention phase, and the post-test measurement was conducted 1 to 2 days after the intervention phase ended.
For the ATM intervention, first a 30-minute initial group training lesson was attended by subjects in the ATM group, with all exercises targeting the lower right extremity as it was the hamstring tested. The lesson introduced the subjects to ATM with 3 movement segments, each with different variations of possible movements requiring lengthening of the hamstring muscles in different postural configurations. This session was recorded and then taken home by each subject. The ATM group subjects were asked to perform 15-minute ATM sessions 5 times per week at home. They were guided by pre-recorded audio-taped ATM lesson sequence for 3 weeks.
Each segment of the lesson began and ended with the body scan in the supine position, where participants were made consciously aware of the quality of neuromuscular control throughout their body. For example, their breathing rate and depth and the levels of tension throughout their body from jaw to foot. Each of the 3 segments started participants in different positions, then different movements were suggested. The goal was for subjects to learn to extend the knee internally, rotate, extending the leg, and arterially tilt pelvis at the same time. This movement organization was designed to lengthen the hamstring muscle. With all movements, they were all done slowly and continuously, breathing at ease, with subjects resting if tired and only moving within a comfortable range of motion, consciously noticing the different movements and efforts that the other areas of the body interfered with specific movements, then trying to reduce other efforts. As well, subjects were told explicitly not to push to the end range of motions, as with traditional passive or active end range stretching.
ATM subjects were asked to use the guidance of the audio tape at their home sessions until they were comfortable enough to continue the movements without it if they wanted. All subjects kept an activity log including all leisure and exercise activities, with the ATM group including specific logs to the ATM movements as far as frequency and duration of each ATM practice. Control subjects were asked to perform their regular daily activities.
The dependent variable was noted to be the hamstring muscle length, which was measured by the maximum knee extension in degrees. The independent variable was the ATM intervention by the number of practice sessions, amount of time practiced, and delay in days in terms of the measurement. The subjects of the ATM group practiced individually for a series of 3 weeks. However, their amount of practice sessions and minutes practiced varied, and due to this variation, there were different delays between their last final practice session and the time of the measurement of their hamstring post-intervention. It is noted that a post hoc multiple regression analysis was used to measure variables on the outcome of the measure of hamstring muscle length change.
At the end of the intervention period, researchers asked the question, from your experience of ATM, would you say that this process is different from stretching as you understand it? After the measurement analysis, subjects of the ATM group were divided into 3 groups based on their change: no change, moderate, and large amount of change. 1 person from each group was interviewed through the use of open-ended questions to engage the participant and researcher to access their understanding and experience during this process. This qualitative method of study was used to help interpret the quantitative data collected.
The results of this experiment revealed that the ATM group had a mean change of positive 7.04 degrees compared to the control group who participated, as they had an average change of positive 1.15 degrees. It was noted that there was a wide variation of practice among sessions between participants of the ATM group, as there was a range between 7 to 18 total sessions and times between 80 minutes to 300 minutes of practicing. One participant didn't hand in an activity log, so that information wasn't available. As well, the range of days between the final session and the measured hamstring was between 1 to 10 days for the participants. The researchers performed a regressional analysis and it showed that there was no relationship or no effect between muscle length change along the number of practice sessions and minutes of practice and the delay between measurement and the final session.
The experiment relates to the concept of the main topic of neuroplasticity discussed in Deutsch's novel The Brain's Way of Healing. Neuroplasticity states that the brain is able to change and adapt through forming new neuronal connections. Awareness through movement is simply being aware of one's movements, and with relation to the experiment, doing ATM exercises has affected the hamstring muscle. This demonstrates the idea that the brain is able to adapt and improve the health conditions of an individual, and with the use of ATM and conscious movements, it can improve balance, find relief from stress to greater ease and pleasure during physical activities.
The results of this experiment lead to the discovery of a possible new paradigm shift. We were told that no pain, no gain was the model to live by when trying to be in the best physical shape possible. The Feldenkrais method, ATM, has shown us that there is a way to help the body without putting it into stress, producing the possible paradigm shift, if strain, no gain.
ATM isn't only about the physical benefits of the body, but also the mental and social benefits. This relates to the trans-domain model of health. Unlike static stretching, ATM focuses more on the small individual movements of each exercise, coupled with conscious thinking of these movements, which affects both your mental and physical health by increasing your personal awareness of your body and space, and therefore increasing the unity of the mind and body, strengthening the mind-body connection.
This experiment was ethical. Before beginning the study, the purpose of the experiment was explained and participants signed an informed consent form which is approved by the Widener University Committee for the Protection of Human Subjects. The movements of the ATM exercises were not dangerous to the body, and each participant was allowed to rest when tired and allowed to withdraw from the study for any reason, as 11 participants did.
The significance of the results overall shows that there's a perceived increase in hamstring muscle strength in the ATM group. For an example, in one of the exit surveys, one participant stated that they concentrated more on movements and that it didn't stress their back as much. This demonstrates the usefulness of ATM. The article has contributed to society in numerous ways. To begin with, the concept of awareness through movement has allowed for improvement of balance and coordination for people with extremities such as multiple sclerosis and cerebral palsy. It helped increase their muscle strength in their hamstrings. It allowed for balance and mobility in people who have gotten into cardiovascular accidents. This article has allowed for the opportunity for more research to help identify the benefits and understand more of the importance and relevance of ATM and how we can use it in our daily lives. The idea of awareness through movement has allowed for a more modern take on the original stretching, which leads to a paradigm shift. It also allowed for people to understand why hamstrings are so important and how they contribute to the control of human movement and how they're involved in a wide range of movements.
There were definitely more limits than merits in this study. Firstly, there is a very limited research done around this topic with limited sources and positive feedback. The only other known study has found no effect on ATM on the hamstring muscle length, with a very brief intervention. Secondly, very few participants actually took part in this study, and the study was done over one trial. Subjects qualified for the study if they did not have a history of orthopedic problems within 1 year from the beginning of the study. Subjects were also excluded if they had an active knee extension angle greater than 165 degrees, which narrowed the range of data collected. Another limitation was that the subjects were also not monitored. Independent home practice brought up some questions. Were they even doing it? Were they even doing it correctly? Were they more physically active during this time? There was a concern that they may have slipped into a familiar pattern of doing stretching rather than ATM as taught. There was also an inconsistency in the data collected. Subjects differed widely from each other in the number of practice sessions and total minutes practiced. Furthermore, because all subjects in the ATM group did not follow the same practice schedule. Their post-intervention hamstring muscle length measurements were done with different periods of delay following the time of the final practice session. Furthermore, the action of performing ATM is very subjective. Each subject interprets the movement in different ways.
The study offered a general perspective of possible merits. It claimed that ATM could potentially prevent hamstring injuries. They also claimed that ATM could increase muscle flexibility by creating more dysenergic control, whereas a lack of control is a common cause for hamstring muscle injuries. Another claim was that ATM helped analyze the efficacy of static stretching. The findings of recent studies suggest that running or jumping performance was not enhanced by static stretching and that ATM could possibly replace static stretching in the future. But again, there has been no research done to back up this claim. The study also demonstrated ATM helping people with low pain tolerance. Steffens and the other researchers claim that in their pilot work and in this study, subjects reported that ATM process was more gentle, less of a strain, and generally less painful than stretching. These reports suggest ATM use in elderly people and people who have chronic and/or low pain and stress tolerance could be of great value. Lastly, the researchers determining the knee angle of each participant was not aware of the group each subject was assigned to, so the subject was done blindly, reducing possible researcher bias.